Anishinaabe, and neutral people. We acknowledge the enduring presence of the Indigenous people with whom we share this land today, their achievements, and their contributions to our community. I would now ask Caitlin to conduct the roll call.
Chair Redmond,
Present.
Councillor Armstrong,
Present.
Councillor Clark, Councillor Erb,
Present.
Councillor Foxton,
Present. Councillor Clark is here. She's just on mute, so I don't know if she answered or not, but she's on the list.
Councillor Galloway,
Present.
Councillor Harris, Councillor Jaworski,
Here.
Councillor Jowett,
Here.
Councillor Kiefer,
Here.
Councillor McGarry, Councillor Nowak,
Present.
Councillor Shantz,
Present.
Councillor Strickland, Councillor Verbanovic,
Howdy.
and there's regrets from Councillor Lawrence.
Thank you very much, Caitlin. I would now entertain a motion to hold an emergency special council meeting as Board of Health. Moved by Councillor Kiefer, seconded by Councillor Shantz. Colleagues, this needs to be a recorded vote, so I'll ask Caitlin again to go through the roll call.
Chair Redmond,
In favor.
Councillor Armstrong,
In favor.
Councillor Clark, Councillor Erb,
She said in favor. I don't know if you heard her. Elizabeth, we couldn't hear you when you said it.
Sorry, I have been having trouble with my volume for a few days. I don't know what it is, but I am in favor.
we can hear you now. Sorry, Councillor Erb,
In favor.
Councillor Foxton,
In favor.
Councillor Galloway, Councillor Jaworski,
In favor.
Councillor Harris, is he in yet? Councillor Jowett,
Favor.
Councillor Kiefer,
In favor.
Councillor McGarry,
In favor, and I'm also present.
Councillor Nowak,
In favor.
Councillor Shantz,
In favor.
Councillor Strickland,
In favor.
and Councillor Verbanovic.
In favor.
That's carried.
Thank you, colleagues. Are there any declarations of pecuniary interest under the Municipal Conflict of Interest Act? Seeing none, we will go directly to our COVID-19 update. And again, colleagues, I want to thank all of you for meeting on short notice. And I know some of you are under tight timelines. So over to you, Dr. Wong.
Thank you, Chair Redmond. Good afternoon, councillors, and Happy New Year. Thank you for the opportunity to present an update on the COVID-19 situation. Thank you, Kathy, for projecting my slides. I'll go to the key messages. So, first message, due to the fact that it spreads so easily and so many people are being infected with Omicron, even if only 1% of those infected require hospital care, the sheer number of those requiring hospital care is projected to overwhelm the healthcare system in January. As a result, the province will revert back to a modified Step 2, and hospitals have been directed to cancel all non-urgent, non-emergent surgeries and procedures starting tomorrow to cope with the tremendous healthcare strain that is expected. This strain is exacerbated by health personnel shortages due to healthcare workers becoming infected or needing to self-isolate. And also, as we've heard, schools will revert to online learning for at least 2 weeks. If we go to the next slide, please. Regarding local trends, so what are we seeing locally? What we're seeing locally mirrors what we're seeing across the province. We have a high exponential growth in the number of cases, although right now with the testing prioritization that's being done, the number of cases is underestimated. We have rising hospitalizations. We have rapid growth of cases and outbreaks in high-risk settings, such as long-term care, retirement homes, and hospitals. We have a growing number of healthcare workers who are off sick or needing to self-isolate. So, in summary, the projections from the Ontario Science Table are being realized. And Ontario expects a continued acceleration in cases, driving increased hospitalizations throughout January. With Omicron, it is expected that it will be hospitalizations and relatively shorter hospitalizations as opposed to longer ones, rather than ICU admissions, that will drive the healthcare capacity challenges. So that's why it's important to watch not only the ICU admissions, but also the number of hospitalizations. Even if only 1% of cases require hospitalization, it was approximately 4% with previous variants. Ontario anticipates the healthcare system is likely to become overwhelmed in the near future. And that is why the actions that were taken by the province were taken yesterday. If we go to the next slide, please. So the next slide shows a graph of our case rates, which is on top, and you see the very rapid rise in our case rates. And then a graph that looks at our hospitalizations and ICU admissions. Hospitalizations in blue, ICU admissions in orange. You can see the very rapid increase in hospitalizations. Although the ICU admissions are starting to slowly climb in Ontario, it's not at the same pace. But as I mentioned, what we're seeing with Omicron is this great demand for hospitalization, even if it's not as much of a great demand for ICU admission. And as I mentioned, the caveat is that now case rates are significantly underestimated and will continue to be significantly underestimated going forward. So other indicators like percent positivity or the number of tests that test positive over the number of tests that are taken, wastewater monitoring, and hospitalizations and outbreaks in high-risk settings will serve as more telling indicators of the impact of the Omicron variant. So together, if we look at all these indicators, they are signaling that Ontario and Waterloo region are on the ascending curve of the Omicron wave, with increasing incidence among older age groups now appearing, and that will drive hospitalizations and impacts in high-risk settings like long-term care homes and hospitals. Second to last slide, please. I just wanted to provide a reminder about recent provincial testing and case and contact changes. So PCR testing is limited to the highest risk individuals or settings. those who are symptomatic with COVID-19 symptoms or who test positive on a rapid antigen test are asked to self-isolate, inform their own contacts, and not seek confirmatory PCR testing unless they are in one of the high-risk groups and need healthcare. The provincial supply of rapid antigen testing, which is overseen by the province, is being prioritized for these highest risk settings that will need to continue critical and essential services. Across the province, case, contact, and outbreak follow-up by local public health is being focused only on the highest risk settings. The large majority of cases are being followed up by a provincial workforce, and these cases are given instructions to inform their own contacts. Only cases associated with the highest risk settings are followed up by local public health for case, contact, and outbreak management. Local public health is therefore unable to track and subsequently report on cases and contacts in settings outside of long-term care, retirement homes, other congregate settings housing high-risk individuals, and hospitals. And last slide. So what can residents do? This will be a very difficult month for us as a community and as a province. We can continue to help each other. Each of us can continue to, 1, minimize all non-essential contacts, and 2, book or help friends and family book an appointment for a first, second, or third dose. Vaccines remain the key to our long-term success against this virus. And they are preventing many severe outcomes that would have otherwise occurred with this current wave. And I wanted to highlight 2 resources that will be helpful for our residents. 1, a new COVID-19 webpage called What to Do If Exposed, which will help guide you through what to do if you're exposed, develop symptoms, or test positive, as well as an updated COVID-19 self-assessment tool that people can take if they're having symptoms. Thank you. I'd be happy to answer any questions.
Thank you, Dr. Wong. I'm going to ask colleagues' indulgence. We have 2 area mayors that have to run off to meetings, and I'm going to ask, I have written down everybody's hand who's up, but I'm going to ask David Aoki, representing the Vaccine Task Force. He's Director of Infectious Disease and Chief Nursing Officer. David, welcome. If you'd like to give your update now, hopefully everybody can hear your update, and then we'll go to questions. So welcome, David.
Thank you, and through you, Madam Chair. So I'll keep it short. We have been increasing capacity to provide immunizations through opening a hockey hub style at Binghamton's since just before Christmas, and we are continuing that at least through the month of January. As well, we are setting up a hockey hub style at our Pine Bush location, and they will begin immunizing using the hockey hub this week. We have partnered again with the Red Cross, as well as a recruitment and staffing firm, Hourglass HR, clinics this week at 99 Regina for the Red Cross, and Hourglass HR is going to be providing clinics at 150 Frederick and some other locations throughout the region for January and February. From December 23rd right through to Sunday, January 2nd, we did provide probably our largest sustained immunization in at least since the summer of July. We provided 72,000 doses over the last 2 weeks between all our modalities. That's public health clinics, pharmacy clinics, and primary care. The one rate limiting thing is we are experiencing a provincial Pfizer shortage, which is having some effect on uptake, as many of our residents in our region do prefer Pfizer over Moderna, as we had Pfizer early on in the vaccine rollout. But at this time, we are sticking to our provincial guidance in order to spare Pfizer vaccines, particularly for those under 30 years of age, and including some special exceptions that the province has made to First Nations, Métis, and Inuit, and healthcare workers. Sorry, not healthcare workers for Pfizer, for those who have received viral vector vaccines and are requiring a second dose of an mRNA that they started their first dose of Pfizer. We continue to work with our community partners daily to find more opportunities to immunize those who may have barriers or access issues to mass immunization clinics. We are also looking for ways to ensure that our 70+ population has access to boosters as well, understanding that they will be most affected potentially should they become infected. So I'm happy to take any questions once we get there, Madam Chair. Thank you.
Thank you very much, David. I'm just going to do a quick check. Councillor Nowak or Armstrong, do either of you have questions before you have to leave?
Sam, I'm good for another half hour, so I can
Okay.
sit through the questions.
Thank you.
That's a negative for me, and I'm on my way.
Thank you, and thank you for being here, both of you. Well, all of you. Councillor Jowett, please go ahead.
Thanks, Chair Redmond. So thank you, Dr. Wong, again for your patience. I don't know how you can keep following this bouncing ball. And a lot of constituents are equally confused, and I think we're doing our best to dispel the confusion frontline. And they are exasperated because there's no testing. They don't know how to get the tests because they are, I think dental is a significant concern, dental operations, because they use respiratory tools, and there's some concern around that, and there's concern around vulnerable populations still coming in. So I'm not sure if this is a bigger problem or not, but have you heard, and I know testing is not our bailiwick, so I'm sorry, I just don't know what else to do with it. So any word on the antigen testing or more supplies or what that looks like? Because we have such a short time frame, I think, here of significant need in this small window. So do you know anything about what's happening with that kind of antigen testing at least?
Mr. Lochner?
Right.
Sure. I can start, and Dr. Wong may have additional information. I know Dr. Moore, the provincial medical officer, indicated they hoped by mid-January to be able to have a larger rollout across the province, but it is a global supply issue. And as Dr. Wong emphasized, we're all troubled by that. That's the reason people are wondering why. Global supply issue, and we are prioritizing the rapid tests for the priority settings, and that's going to be a reality, we hope, by mid-January. But again, we're stuck in this global supply crunch.
Dr. Wong?
Yeah, no, I did. Mr. Lochner said it well. The distribution of rapid test is overseen by the province. We don't have a role in it. They are requiring a lot of rapid tests to be able to do the serial testing in those critical and essential services, to enable people to continue working despite the increased absences. And so, those are the sectors that will be prioritized, as we understand it, until the supply improves on a global, national, provincial level. For the general public, if you have symptoms of COVID, it's recommended that you consider yourself as being positive with COVID due to the fact that it is very prevalent right now. So that's the advice.
Thank you. Councillor Jowett, do you have a second question?
No, that's, I just wanted to get a kind of a detailed response for someone that phoned in today, and I can appreciate it's, again, not our responsibility, but I think we're going to get lots of calls on that. So thanks very much, Dr. Wong and Mr. Lochner, much appreciated.
Councillor Jaworski, I had you up next.
I'm all good, all answered.
That's great. Councillor McGarry.
And thank you through you, Chair. Thanks, Dr. Wong, and to your whole team for doing what you're doing and getting us connected today. My question has to do with outbreaks in long-term care. Generally speaking, when there's an outbreak in long-term care, those residents that were sent to hospital or those residents who are now going to be placed in long-term care have to be held under ALC in hospital while they wait for the home to go through a fairly lengthy process to open up the whole home again to admissions. So my question is there going to be a potential change in the process as hospitals come overwhelmed to maybe either shorten the time period for outbreak or maybe just isolate just one particular floor or one particular area in long-term care to allow the readmissions, the repatriation, or people going into long-term care to actually get admitted to that building?
Thank you for the question, Councillor McGarry. So it certainly is a challenge when you have a lot of cases and outbreaks in long-term care as well as in hospitals, because that does slow down the flow of patients. That's true. Issues such as flow of patients as well as guidance to try to balance the risk of spread to other long-term care residents or staff, with trying to make sure that we don't overly slow down flow is something that is regularly examined by provincial expert bodies that look at that. And we recognize that right now is a challenge, but currently, the measures that are being put in place in long-term care homes and the outbreak guidance that public health units will follow in helping to advise the homes, they're based on what the province believes is best in terms of the level of measures that need to be put in place, while not unnecessarily tying up flow if possible. But it doesn't eliminate the fact that this is a very challenging time, because every time you have people that are potentially infected with COVID, you do have to make sure you have in place measures, and sometimes you have to close down parts of a home or entire home to further admissions. And so it is an intrinsic challenge with so much infection that flow will continue to be an issue, and we're just going to have to keep monitoring what might be possible without putting residents at further risk.
Councillor McGarry, do you have a second question? Thank you very much. Councillor Vanovich, please go ahead.
Thank you very much, Chair Redmond and Dr. Wong and David and team. Thanks for all of your ongoing work, even over the holidays when I know you were trying to take a little bit of a break, and unfortunately COVID hasn't taken a break to go along with that. I do have a couple questions. The first one just has to do with respect to vaccine and vaccine availability, and I think we've done an incredible job of ramping things up over the last little while. I know one of the questions that I'm getting is, with the current shutdown and so on, there's a real desire to say, like, let's get our kids back to school, But let's make sure we do it safely, and let's make sure they're as best prepared as possible, or best protected as possible. And so there's questions around, is there anything we can do to expedite over the next 3 weeks? Obviously our older adults are a priority, but some of our healthcare workers and first responders. But beyond that, is there anything we can be doing to try to accelerate vaccine availability, slot prioritization, whatever, for both our students and teachers over the next few weeks to really give them the ultimate protection once they do go back into the classroom?
So Dr. Wong or David, who wants to start off? David, go ahead.
I can respond first, and Dr. Wong. So thank you, through you, Madam Chair. Thank you, Councillor Vrvanovich. It's an excellent question. And I would like to say, while we prioritize certainly the 70 plus and third doses, we have not forgotten about our students. At last count this morning or this afternoon, we still had almost 10,000 appointments available for pediatric immunizations at our Boardwalk and Pine Bush locations. The Hockey Hub model is not a great model for pediatrics, just because it is really kind of an in and out flow style model, but both our Pine Bush and Boardwalk locations are set up for children. I know Camp Pine Bush, we certainly have seen a lot of. So we would encourage parents, if they do have children home and they have the opportunity to bring them in for a first dose, if they're eligible for their second dose, it is still recommended provincially to wait 8 weeks between doses. But there are students who will start hitting that 8-week period starting soon. And so we do have lots of appointments available for students. We are also actively working with the school boards, and while teachers aren't prioritized, we are certainly working to see what we can do to support the school boards as far as educator immunization, encouraging educators to, again, use this time to get immunized with their third dose prior to returning to in-class learning, because it's certainly a goal as well, as in-class learning.
That's great to hear. Thank you for that, and I'm sure that information will be well received. For those that are just turning 12, or I guess just turning 5 this year, does the date kick in on the calendar year or on their actual birthday? That's another question I've been getting, and I don't know the answer to that.
You want to take that one, David?
Sure. So it is right now, the provincial guidance is it's by date of birth, not by birth year. So they do now have to wait until their 5th birthday to change that. I certainly know that there is a lot of questions about that, and we would wait to provide direction if that's going to change. But right now it is by their birth date. So on the date of their appointment, they must be 5.
Okay, and the last question then, if I may, Madam Chair, Dr. Wong, it's for you, and it's with respect to, and I guess it really came down from the province, but the decision to not report outbreaks anymore, like school outbreaks, workplace outbreaks, and so on. And I get it, like, it gets hard because we don't have all the data anymore, because people aren't necessarily reporting into us, since they're not, since they're just assuming that they have COVID. But certainly from parents, there's some angst around that, because they felt some comfort in knowing either their school had it or they didn't have it. Now, obviously, we've had a bit of a reprieve on that for the next couple weeks while they're at home, learning from home. But is that something that we may revisit locally, and see if it's information that we could provide again? Because I know it is something that I've heard from many parents who have concern around it.
Well, thank you for the question. I understand it's a significant shift from what we used to do, where we would track every case. But we would no longer be able to track cases, and that's why we won't be able to report on them. So there is the testing, prioritization that's taken place, but there's also the fact that the large majority of cases, we're not following up on them. So we wouldn't know who they are and what school they go to. But there will be other indicators that the province will bring in for monitoring at school, such as absenteeism indicators. The shift is in line with the recommendation now for people really to stay at home if they have symptoms. There will be an updated screening tool that will be a bit more sensitive for parents to go through before sending their kids to school. So staying home if symptomatic, and unless they need medical care, which they can always access if they need, through normal clinical channels, it's recommended that they stay at home and self-isolate. So it's really in line with that shift, with the number of infections that we have in the community, which is likely multiple times what we're actually able to detect with PCR testing now. The best thing to do, because for a lot of people this is not going to result in serious outcomes, is to just stay at home. If they develop symptoms, isolate for a period of time, and not seek testing or care. And so the ability to be able to track individual cases is not going to be possible in that kind of new paradigm.
Okay, great. Thank you to both of you for your answers and for your ongoing work.
Mr. Lochner, did you want to add to that answer? Okay, thank you. Councillor Galloway.
I've got two questions. They've both been partially asked. I'm going to scope them a little bit. The first is to do with the rapid antigen test. Dr. Wong, you made it quite clear that it's the province who is responsible for the procurement and the distribution of the rapid antigen test. The Ministry of Education, Ministry of Health, whoever, and there was a pop-up, I guess, distribution today or yesterday at Fairview Park Mall, which of course was exhausted within a short period of time. But it's symptomatic of people who believe that the rapid antigen test is a good indicator, and I'm hearing from people who have acquired the rapid antigen test either at the pharmacy or through the schools or wherever they've been able to get them, and they are using them, prior to social gatherings to say, okay, everybody take a test, and then we'll know whether or not we're safe to socialize together. What is the guidance on the use of the rapid antigen test and its reliability?
Thank you for the question, Councillor Galloway. So rapid antigen tests can be an added value in certain circumstances, such as if you have a healthcare setting, for example, and you're using it in a serial way. That means repeating it frequently during the week, repeating it every week, as an additional measure on top of all the other measures that are recommended, to try to reduce the potential for people who may be positive but are not otherwise detected to be positive. It's not really made for one-off tests, frankly, to just make sure you test negative before you go to a gathering. The performance of rapid tests will change depending on how prevalent the virus is in the community. Right now, and especially with the characteristics of Omicron, if you happen to have a rapid test and you use it and you test positive, that means that you're positive. You don't need a confirmatory test. It's highly likely you're positive, and you're asked to just assume you are and self-isolate and inform your contacts. Now in the current situation, if you test negative, that means that you still have to take all the precautions that you were going to take, such as minimizing the size of your gatherings, masking, distancing, ensuring good ventilation, because you cannot be sure that that test is negative and that you're not infectious. So, and again, if you have rapid tests and you're trying to, see if you turn positive potentially after an exposure, you have to keep testing yourself. It's not a one-off thing that is very reliable. And so, with rapid antigen tests, if people happen to have them, they should use them to signal if they're positive that they're positive. But if they're negative, they can't assume that they're not infectious. And so they need to continue to take all those precautions that they were going to take. What they can't do, and I'll be just very frank, they can't test negative and say, oh, it's okay, now we can gather like we thought we would be able to with lots of people, no mask, no distance, because that's not a safe way to use the rapid tests. But they're helpful in certain work situations.
Yeah.
For sure. Yeah.
I think that's an important message.
Councillor Galloway, do you have a second question?
I do, Madam Chair. It's a bit of an extension of Councillor Urbanovic's question. Has to do with the school children, but particularly the 5 to 11-year-old group. They were green lighted not that long ago. And as you know, I watched the dashboard fairly closely, and the number of 5 to 11-year-olds who are getting their first doses has slowed to a crawl, it seems. I think on average, about 300 people per day get their first dose, and probably most of those are in that 5 to 11-year-old group. But right now, it's at about 46%, according to the dashboard. And that really hasn't moved a whole lot, or not very quickly. When the 12 and 17-year-old group was green lighted, that went fairly quickly. And they are now well over 80%, well into their second doses and even some thirds. Are we concerned about the slowing of the 5 to 11-year-olds, particularly when we do talk, as Councillor Urbanovic did, about trying to make schools as safe as possible? There seems to be, I don't know, a reluctance or some impediment. At least to me, it appears that it has slowed much more than any of the other age categories when the various age categories were green-lighted. So I don't know if David or yourself, Dr. Wong, can talk to that.
I'm happy to start, Dr. Wong, and then so I agree. I think we would like to see our numbers higher. Councillor Galloway, it's a good point and question. I think we have a few factors that are working against us with this group as opposed to other groups. Mainly the messaging, and it's been consistent throughout the pandemic, but since the vaccine has come out, that children don't get horribly sick with COVID, and so the vaccine is relatively new for children, and parents are taking their chances with what they perceive to be a relatively mild illness versus the unknown of vaccine side effects, even though we the vaccine to be safe, and we trust the science on that. So I think that's one thing that's an uphill battle. We continue to try and promote the vaccine for children, and we continue to try and encourage parents to get it. Certainly, I think that's something I can take away, and we can look at doing a better job of trying to increase those, given that we still have, like I said, those almost 10,000 appointments available for children's shots in our clinics. Because it is, with schools opening, that's certainly an area where transmission will continue to occur when schools reopen, and it's something we would want to spread decrease the spread. But I think the hesitation for parents comes from that messaging that COVID is relatively mild in children, and I think with Omicron that's even more true, where even adults are experiencing milder symptoms. But again, our goal is to prevent transmission and infection altogether, so that visiting grandparents or other people who may be immune compromised, they're protected from that herd immunity. So it's something we'll take back with our group, certainly, and see what we can do to increase those rates. But it is something that we would hope our rates are higher in that area as well.
Dr. Wong, did you want to add anything?
Yeah, I just wanted to add that this seems to be a phenomenon seen in other areas of the province as well. There was an initial group that parents who were very keen to have their 5 to 11-year-olds vaccinated, but then after that, there was quite a slowdown, and so the uptake now is a lot slower. So we're gonna, as David said, look into this and redouble our efforts to provide parents information and encourage them to vaccinate their children. Thanks.
Thank you. Thank you, Councillor Galloway. Councillor Erb, please go ahead.
Thank you, Madam Chair. And again, Dr. Wong and David and all of the team, thanks for this heroic work that you're doing for all of us. One of my questions is related to the youth, which has been answered. Second, one of the efforts was going to be to try and involve the business communities that were appropriate, where they could administer vaccinations in those settings. Has that been successful? Are we seeing some progress with that happening?
David, do you want to start with that?
Yes. So thank you, Councillor Erb. A good question. We are working with economic development, but also with our employers directly, our vaccine team, to set up clinics. The limiter for some of the smaller workplaces is that they need to have an immunizer available who can provide the immunizations. But we work with them. We are working with them to facilitate that connection. So whether we do a reach out with for example, with a local pharmacy who may have availability to go in and provide a mobile clinic for a workplace, or with an occupational health firm that we're aware of that we can connect them with to get around those issues. We don't have the ability with our own human health resource issues, and with Omicron, also impacting our staff to staff every employer that needs a clinic. But we're trying to be the facilitator of that. So where we can help them find the resources that they can run clinics for their staff. So we are doing a considerable amount of work to try and make those connections to get that moving for employers as well.
Oh, Rick. Thank you. And my understanding is
not so bad.
Sorry. My understanding is that we can, there's no problem with the supply, that we can, as many places as we can get to administer the vaccine, the supply is available. It's only Moderna at this point. Is that correct?
That's right. We do have supply issues for Pfizer, but Moderna, we don't have supply issues. We have a lot, and there's no rate limiter on providing Moderna vaccine to employers.
Okay. And one more question, if I may, Madam Chair, related to masking. More and more of the messaging is get rid of the cloth masks. What we've been using in the past has not been working in 95. What's the word on the masking and the supply and the recommendations to the public?
Well, thanks for the question, Councillor Erb. So it's not that cloth masks are useless, but it's that with Omicron and the latest review by federal and provincial expert bodies, it's recommended that people try to maximize two things with their masks: fit and the ability for the mask to filtrate particles. And the types of masks that have optimum filtration include N95 masks or KN95 masks or similar respiratory type masks. Respirator type masks, or medical masks also have a high filtration ability. With the respirator type masks, they often fit very well to begin with. And so that's why a lot of people do favor them for use, because they have high filtration ability and they oftentimes fit very well to begin with. With a medical mask, they have high filtration ability, but you have to make sure they fit properly because oftentimes there can be gaps, especially on the sides. And so if someone wants to wear a medical mask, it's recommended that they try to make sure that it fits properly, such as, for example, having a mask, what is it called? Brace, or putting another cloth mask, for example, on top of the medical mask so that it pushes the sides of the mask flush to the face to have a good fit. And what the science is saying is the cloth masks, if you're going to continue to use cloth masks, make sure they have at least 3 layers of good quality material, tightly woven cotton, for example, with a filter layer in the middle. So it's all pointing towards trying to make sure you have good quality masks that not only fit really snugly against your face, but that have very good filtration quality.
And just for clarity, for the public that's listening, by medical masks, Dr. Wong, are you referring to these typical blue masks that you get when you go into some centers?
Yeah, you can. Yeah. That's exactly right. And for some people, they fit well with adjustments to the nose piece, but for many others, they don't fit that snugly, right? So you have to just make sure with those medical masks that they fit snugly, and you can sometimes you can adjust the loops, or like I mentioned, some people will put a non-medical mask on top because that will push the medical mask flush against the face well.
Thank you.
Or a respirator, a KN95.
Thank you.
Thank you very much. I'm going to go to Councillor Foxton and Strickland and then back to Councillor McGarry. So Councillor Foxton, please go ahead.
Thank you. I just wanted to say that when my grandchildren went to get inoculated, they had an amazing time. It was so well done. They had coloring books and it was fun and everything else. Great job. And my children tell other people, get your child inoculated. It's nothing. And the kids have a great time. It's a really positive experience.
Thank you, Councillor Fox. And I think that's a real testament to the people that are on David and Dr. Wong's team and are making sure the volunteers, I've run into a couple of them at 150 Frederick. They're running the clinic here, and the volunteers and the pharmacists and the inoculators really do take a lot of joy and attention in their job. Councillor Strickland.
Thank you very much, Madam Chair, and I would agree with the vaccination rollout and how customer friendly it is, having to take a family member in for a booster shot over the holidays. So well done. We just got to keep it rolling for sure. My question and comments are around the PCR testing. Having experienced over the holidays trying to get a PCR test, it was an absolute gong show. The next day tests, if you had the browser working rightly by 7:01, all the, if you had a chance to even get in by 7:01, all the tests were fully booked for the next day. And then when you had to go to a pharmacy, it took you 4 or 5 or 6 days to get in for a test. And then you didn't get results for 4 or 5 days after that. So who knows if you had COVID or not. So it completely makes sense to me that the province has basically shut that PCR testing down for the general public because the system was overwhelmed by the number of requests. And I guess, going back to some of the comments that were made around the rapid tests, I understand there's some caveats around the rapid tests, but I don't understand why in Ontario they're not rapidly available. Because if you test negative, you test negative. And so you know what to do rather than kind of, well, do I have a cold or do I have COVID? People have to make a judgment call. The rapid tests are like readily available. I have colleagues like in Alberta and BC, Atlantic Canada. They can get 4 or 5 or 6 rapid tests at a time and take them home with them. And I don't understand why in Ontario, unless plans to happen soon, that rapid tests are not readily available for the general public in an abundance of supply. Dr. Wong, I know this is not your bailiwick. This is a provincial initiative, but it's just beyond me when I hear what's happening in other provinces and their access to rapid tests. We don't have the same access here in Ontario. Is that going to change anytime soon?
I don't know. Is that a question for Dr. Wong or Mr. Lochner? Do you want to take that? I see your.
Yeah, I can start, and I think we may have had this question a little earlier too. Just recognize timing of the meeting. What was difficult for everyone. Councillor Strickland, what I said earlier is the Chief Medical Officer on Friday for Ontario said that this is a global supply shortage, that Ontario hopes to have more rapid tests about mid-January, maybe the third week of January. But again, he emphasized it's a global supply shortage. So I'm not sure how other provinces are in any better circumstance than us, given we're hearing similar challenges. We did say that given that the provinces asked us to, well, not asked us, but they are distributing to higher priority groups at this point, given so many rapid tests are being used by those and needed by those higher priority groups, including first responders as an example. So I don't know if Dr. Wong may have more to add to that.
No, I think you've summarized it well, Bruce. And I would just mention again, I'm sorry, Councillor Scripton, I wasn't sure when you entered the meeting, but in the current Omicron context, the interpretation of rapid tests should be if you're positive, you're positive. If you have symptoms that are consistent with COVID and you test negative, it doesn't mean you're negative.
Right.
So you should still self-isolate because it's so prevalent, and the test isn't, in this kind of context, the test isn't as sensitive anymore. So, well, not that it's not good. There are limitations, but you know, it's a test that can be it's a tool that can be of added value, but we can't take a negative to mean a true negative in this.
Especially if you have symptoms. I understand that, but to me, it is a tool that we need to help curtail the spread of Omicron. And unless things have changed in the past few days, and maybe Bruce knows more about what's happening in other provinces than I do, but there certainly is much tighter restriction on supply in the province of Ontario. And I don't know if the other provinces bulked up on pre-ordering the testing packages or not, but this is a real concern to me, and hopefully the province can rectify that sooner rather than later. So thanks for your responses on that. I know it's not out, it's outside of your responsibility, but it is certainly a sense of frustration, and I share that frustration because I went through it for from December 23rd to January 3rd. It was, an absolute disaster to try to get tested. The other question I have is with the hospitals and ICU admitting, the admission rates. And Dr. Wong, you said that right now in our ICUs we have 51, I think it is. Mm-hmm. And what's their capacity?
So that's a very high level of hospitalizations. It's a kind of closing in on the peak of some previous waves where we had our highest peaks. With Omicron, what we're seeing is you are going to have a significant increase in hospitalizations, but you likely won't have as many long hospital stays or ICU admissions. Yeah. But the increase in hospitalizations, because it's so rapid and it's sort of happening all at once, it is putting an incredible strain on the healthcare system. So it is still with 51. That's a lot because of the fact that it's happening all at once, and it's also happening at a time when many healthcare workers are not able to work because they've become infected themselves or they have to be isolated. So it isn't so much purely just how many beds do we have, right? It's more how many staffed beds, would have, and what is the volume that of other COVID, other non-COVID health issues that the hospitals have to deal with as well. So yeah, so our stats are really reflecting only just the sudden increase and rapid increase of hospitalizations that are associated with COVID. And what we do know from our healthcare partners on the ground is that similar to all across Ontario, and even other places are a bit worse right now. There is a lot of pressure on hospitals and on various healthcare sectors, including the long-term care sector, due to the sheer number of cases and outbreaks and staff absences.
Yeah, Dr. Wong, I appreciate all that. I understand all the different variables as we go through this fourth wave, but it's published, I think, daily on the dashboards what our capacity is for ICU and how many ICU beds are currently being used. And the last documentation I read said it's increasing, but it's not increasing as nearly as fast as when we were dealing with the Delta variant. So, so we have 51. But what is our capacity locally? Is it 80? Is it 120? I don't know I can't recall from our latest stats what our ICU capacity is, just for interest.
Yeah, I don't have the numbers. That's something we'd have to take back and ask the hospital leads to provide us. And so I don't have the exact number of capacity.
Okay, thanks. Just one final question. Thank you, Madam Chair, and thanks to the team. Is it still approximately 80% of hospitalizations and ICU admissions are among the unvaccinated?
Yeah, what we're seeing, Councillor Strickland, is even with Omicron, it's the same picture in that those that are unvaccinated continue to be very significantly overrepresented among those who need serious hospital care and ICU care. So yes, the statistics, it's still in the many multiples in terms of increased risk among those that are unvaccinated compared to those who have had 2 doses at least, to be hospitalized and or to have to then receive ICU care.
Right, I appreciate that. Thank you. I just, when I hear that as, a fully vaccinated person and committed to that vaccination, like 80% of our residents, and look at what we're going through again as a province, with the significant reason we're going through this again, it's because of the people who haven't got vaccinated. And I don't know what that means for public policy coming out of this wave, but it certainly is a source of frustration for me and many others. And to have this province go through another stage of lockdown, largely attributable to the unvaccinated, to me is very unpalatable. And it needs to be given some sober thought going forward from a public policy perspective on how we could change that. So thank you very much for all the work that you do. I really appreciate it. And I know it's challenging times. Hopefully this will be the end of it.
Councillor McGarry.
Thank you. My question was triggered by the 2 sections that you're going to be adding, what to do if exposed, and updated self-assessment questions. Certainly there's a lot of questions, Dr. Wong, about how to care for somebody that does have symptoms. And I'm just wondering whether there is a section that would be available for families, for parents, for pediatrics, including some of the resources that are already out there like telehealth, to kind of take some of the edge off of symptomatic relief advice, because many people don't know what to do if they haven't experienced that before.
Yeah, so thanks for the question. We do have some resources, I believe, on our website, but what I'll do is I'll take that back to make sure, it has the latest guidance associated with it. And if not, we'll update it. Thanks for that idea.
Well, thank you, colleagues, for your thoughtful questions. I will now entertain a motion to adjourn. That is moved by Councillor McGarry, seconded by Councillor Foxton. Please use your icons to vote yes or no. That is carried. Thank you, colleagues. And again, this was short notice, but a very important meeting, and great that we can provide this update and this information to the community who are watching. So thank you very much. Everyone stay well and Happy New Year.